Congenital heart disease. A 1-month-old baby was presented with a history of shortness of breath and poor growth. The baby had bluish skin. On clinical examination, there was a systolic murmur. The child was kept on percutaneous oxygen saturation of 100%. And an abnormal ECG graph was obtained with unusual rhythm, speed, and evenness of the heartbeat. ECG showed the presence of VSD.
Congenital heart disease, CHD, is the abnormality in the structure of the heart or great vessels that are present at birth. It usually arises as a result of faulty embryogenesis. CHD disrupts the normal flow of blood through the heart. Severe heart malformations are incompatible with intrauterine life, whereas considerable cases are generally seen during birth or even much later. Some of the common symptoms observed in toddlers include cyanosis, poor feeding, rapid breathing, tachycardia, chest pain, tiredness, excessive sweating, and slow growth. Causes of congenital heart disease. Congenital heart disease occurs due to defect in the development of the heart during embryogenesis, during the gestational weeks 3 through 8, the time period in which the formation of major cardiovascular structures takes place. The structural defect interferes with the normal flow of blood through the heart, further also affecting breathing. The cause of congenital heart disease is multifactorial, involving genetic and environmental influences. Intake of certain prescription drugs during pregnancy, using alcohol or illegal drugs during pregnancy, or mothers getting viral infection like rubella during the first trimester of pregnancy are also implicated in causing congenital malformations of the heart. Classification of congenital heart disease. Congenital heart diseases are classified into 3 groups. These are malposition of heart, shunts, cyanotic congenital heart disease, obstructions, obstructive congenital heart disease. Malposition of the heart. It is a rare condition in which the heart is positioned at a place other than the normal place. The most common form of malposition of the heart is dextrocardia. It occurs when the apex of the heart points to the right side of the chest instead of the left side. It may or may not be associated with situs inversus, wherein other organs of the body are also interchanged or inverted. This involves major anomalies of the heart, such as transposition of atria in relation to the ventricles or malformations of large blood vessels. Another type of heart malposition is mesocardia, where the heart is positioned in the middle of the thorax with normal atrial and visceral anatomy. Levocardia or left-sided cardiac apex with abdominal situs inversus is also an extremely rare case of malposition of the heart. Shunts. A cardiovascular shunt or cardiac shunt is an abnormal pattern of blood flow in the circulatory system due to abnormal connections between the pulmonary and systemic circulations. shunts are classified into two groups: left to right shunts and right to left shunts. Left to right shunts. It is also known as acyanotic or late cyanotic group. In left to right shunt, the oxygenated blood flows directly from the systemic circulation to the pulmonary circulation. This shunting of blood from left to right side of the heart results in volume overload on the right ventricle and consequently causes pulmonary hypertension and right ventricular hypertrophy. There is a decrease in tissue oxygenation through reduced cardiac output, resulting in late cyanotic heart disease. The different conditions causing left to right shunts are ventricular septal defects, atrial septal defects, patent ductus, arteriosis. Ventricular septal defects (VSD). In this clinical situation, there is a hole or septum defect at ventricles, thereby resulting in free communication of blood between the two cavities and hence intermixing the blood from the systemic to the pulmonary circulation. The oxygenated blood flows from high pressure left ventricle to low pressure right ventricle, resulting in extra pressure to pulmonary artery and therefore to lungs. This leads to an increase in pulmonary venous return to the left atrium and then to the left ventricle, resulting in left ventricular dilatation and hypertrophy. It is the most common congenital heart disorder and is recognized early in life. It comprises of 30% of all congenital heart disease. If the defect is small, it spontaneously repairs. However, larger defects fail to close and thereby produce abnormalities. Ventricular septal defects are of two types. Presence of membranous septum very close to the bundle of His. It is seen in 90% of the cases. In 10% of the cases, VSD is present below the pulmonary valve, subpulmonic, or below the aortic valve, subaortic. It may also be present in the form of multiple defects in the muscular septum. Morphological features: volume hypertrophy and endocardial hypertrophy of the right ventricle. Hemodynamic changes, enlargement of tricuspid and pulmonary valve, mitral and aortic valve. Pressure hypertrophy of the right atrium. Volume hypertrophy of left atrium and left ventricle. Symptoms: dyspnea during feeding, poor growth, loud, holosystolic murmur. Atrial septal defects. ASDs are abnormal openings or hole in the atrial septum caused due to incomplete tissue formation. This causes free communication between the right and left atria and causes 2 to 4 times the normal pulmonary blood flow. Shunting across the interatrial septum occurs during late ventricular systole and early diastole and results in increased pulmonary blood flow and diastolic overload of the right ventricle. Atria possesses low pressure compared to ventricles and hence the lesion is typically asymptomatic during infancy and childhood and is in adulthood. Atrial septal defects comprise about 10% of congenital diseases. Atrial septal defects are of 3 types: fossa ovalis type or ostium secundum type. About 90% of the ASD cases show defect in the region of fossa ovalis. Ostium primum type, a rare case. The defect is situated low in the interatrial septum next to atrioventricular valves Mitral insufficiency may be seen due to a cleft in the aortic leaflet of the mitral valve. Sinus venosus type. A rare situation. There is a defect in the high position in the interatrial septum near the entry of the superior vena cava. Morphological features. Volume hypertrophy of the right atrium and right ventricle. Hemodynamic changes and enlargement of tricuspid and pulmonary valves. Diffuse or focal endocardial hypertrophy of right ventricle and right atrium. Small-sized mitral and aortic orifices. Symptoms. In most cases, children seem healthy and appear to have no symptoms. Children with severe ASDs may show symptoms like poor appetite, poor growth, fatigue, breathing problems, and infections like pneumonia. With aging, the risks of stroke also increases due to formation of any blood clot which can pass through the hole in the septum and travel to the brain. Pulmonary hypertension, high blood pressure in the lungs, is seen in older patients. Patent ductus arteriosis. It is a vascular connection between the pulmonary artery and the aorta, just distal to the origin of the left subclavian artery. It is primarily during uterine development of fetus, where the blood flows from pulmonary artery to the aorta, bypassing the unoxygenated lungs, and is known as ductus arteriosus. Post-birth, the ductus gradually constricts and gets functionally closed, and the condition disappears within 3 months of birth. If it is seen persisting even after 3 months, it is called patent ductus arteriosis. It constitutes about 10% of the congenital malformations of the heart and great vessels. It may be up to 2 cm in length and up to 1 cm in diameter. A small patent ductus arteriosis may not require any treatment. However, a large patent ductus arteriosis, if left untreated, can weaken the heart muscle and cause other complications. Morphological features. Left to right shunt at the ductus level results in the following effects. Volume hypertrophy of the left atrium and left ventricle, hemodynamic changes and enlargement of pulmonary and mitral valve, enlargement of the ascending aorta. Symptoms. Characteristic: continuous harsh murmur with rapid heartbeat, poor eating, poor growth, sweating, fatigue. Right to left shunts, cyanotic group. There is shunting of blood from the right side of the heart to the left side, allowing deoxygenated systemic venous blood to bypass the lungs and return to the systemic circulation. Due to presence of poorly oxygenated blood into the systemic circulation, cyanosis occurs. The condition usually occurs as a combination of shunts with obstructions. Right to left shunts are of 4 types: Tetralogy of Phthalate, transposition of great arteries, persistent truncus arteriosus, Tricuspid Atresia. Tetralogy of Phthalate. It is the most common cyanotic congenital heart disease. It is seen in about 10% of children with congenital heart disease. There are 4 cardinal features of tetralogy of Phthalate, which are ventricular septal defect, right ventricular hypertrophy, overriding aorta, right ventricular outflow tract RVOT obstruction, or subpulmonary stenosis. These features develop during embryogenesis, where there is anterosuperior displacement of the infundibular septum. The level of severity of clinical manifestation depends on two factors: the degree of subpulmonary stenosis and the size of ventricular septal defect. Based on this, there are two types of tetralogy: cyanotic tetralogy and acyanotic tetralogy. Cyanotic tetralogy: there is large extent of pulmonary stenosis, whereas the ventricular septal defect is mild. This causes more resistance to the outflow of blood from the right ventricle, leading to right to left shunt at the ventricular level, leading to cyanosis. Defects are as follows: pressure hypertrophy of right atrium and right ventricle, smaller left ventricle and left atrium, smaller and abnormal tricuspid valve, enlarged aortic orifice. Acyanotic tetralogy: in this case, the ventricular septal defect is large, whereas the pulmonary stenosis is mild. This results in left to right shunt with increased pulmonary flow and increased volume of blood in the left heart. There is no occurrence of cyanosis. The effects are as follows: pressure hypertrophy of the right atrium and right ventricle, volume hypertrophy of the left atrium and left ventricle, enlargement of mitral and aortic orifice. Transposition of great arteries: it refers to the complex malformations with respect to the position of aorta, pulmonary trunk, atrioventricular orifices, and position of atria in relation to ventricles. There are two forms of common transpositions: regular transposition. In this transposition, the aorta, which is typically situated to the right and posterior to the pulmonary trunk, is displaced anterior and to the right. In regular complete transposition, the aorta comes out from the right ventricle and pulmonary trunk from the left ventricle, resulting in cyanosis from birth. Corrected transposition: it is an unusual anomaly. Here, there is complete transposition of the great arteries with aorta emerging from the right ventricle and the pulmonary trunk from the left ventricle. This is accompanied with transposition of the great veins as well. The pulmonary veins enter the right atrium and the systemic veins drain into the left atrium. This leads to physiologically corrected circulation. Persistent truncus arteriosis: it is an unusual anomaly, where the arch that typically separates the aorta from the pulmonary artery fails to develop, resulting in a single large common vessel receiving blood from the right as well as the left ventricle. An associated ventricular septal defect may also be present. The orifice may have 3 to 6 cusps. There is frequent systemic cyanosis due to left to right shunt, leading to poor life expectancy. Tricuspid Atresia: it is a defect of the heart occurring in the early weeks of fetal life. The tricuspid valve or the orifice fails to develop. Therefore, the blood is unable to enter the right ventricle, causing abnormal development or small size of that ventricle or hypoplasia. This small right ventricle is supplied with blood through a ventricular septal defect from the left ventricle. The blood circulation is maintained through atrial septal defect that affords communication between the left ventricle and the underdeveloped pulmonary artery. The The affected children are cyanotic since birth and live for a few weeks or months. Obstructions. Obstructive congenital heart disease. Blood flow obstructions may result from obstructions in the aorta due to narrowing, that is, coarctation of aorta, obstruction to outflow from the left ventricle, that is, aortic stenosis, and right ventricle, that is, pulmonary stenosis and atresia. Coarctation of aorta. Coarctation is the local compression or contraction of aorta. It may happen in any part of the aorta, but the constriction is usually distal to the ductus arteriosus, also known as postductal or adult. Or it is occasionally seen proximal to the ductus arteriosus, also known as preductal or infantile in the region of transverse aorta. Morphological features. Postductal or adult type. Here the obstruction is distal to the point of entry of the ductus arteriosus, which is closed. In the places where stenosis is present, the aortic segment is drawn in as if a stitch is tied around it. There is dilation of aorta on either side of the constriction. It is recognized in adulthood. It is characterized by hypertension in the upper extremities, low blood pressure in the lower extremities, weak pulse, effects of arterial insufficiency such as claudication or clamping due to reduced blood supply and coldness. This is usually circumvented by the development of collateral circulation between pre-stenotic arterial branches. This results in enlarged and palpable intercostal arteries and may produce erosion on the inner surface of the ribs. Preductal or infantile type. The clinical symptoms are evident much early in life. The narrowing or stenosis is seen close to the ductus arteriosus, which usually remains patent or open. The narrowing is usually gradual and include a larger segment of the proximal aorta. An interatrial septal defect is also seen associated with this. Preductal or infantile coarctation results in hypertrophy of the right ventricle while the left ventricle is small. There is cyanosis in the lower half of the body while the upper half remains unaffected, since it is supplied by the vessels originating proximal to the coarctation. Children have poor prognosis with this defect. Aortic stenosis and atresia. The most frequent congenital anomaly of the aorta is the bicuspid aortic valve. It does not have much functional significance but predisposes to calcification. Congenital aortic atresia is rare and is incompatible with life. Stenosis of aorta may be congenital or acquired. Morphological features. There are three types of congenital aortic stenosis. Valvular stenosis. The cusps of aortic valve are malformed and are irregularly thickened. The valve may have 1, 2, or 3 such malformed cusps. Subvalvular stenosis. There is the presence of a thick fibrous ring under the aortic valve causing subaortic stenosis. Supravalvular stenosis. This is the most unusual type. There is fibrous constriction above the sinuses of Valsalva. All these result in pressure hypertrophy of the left ventricle, left atrium, and there is dilatation of aortic root. Pulmonary stenosis and atresia. Pulmonary stenosis and atresia do not produce cyanosis. Hence, they are grouped under acyanotic heart disease. Morphological features. Pulmonary stenosis is the most common form of obstructive congenital heart disease. It forms about 7% of all congenital heart disease. It may be seen as a component of tetralogy of Phthalate or as an isolated disease. It is caused by fusion of cusps of the pulmonary valve, forming a diaphragm-like blockage to the outflow of blood from the right ventricle and dilatation of the pulmonary trunk. Pulmonary atresia. There is no communication between the right ventricle and lungs. Hence, the blood bypasses the right ventricle through a defect in the interatrial septum. The blood later enters the lungs via patent ductus arteriosis.